Welcome to this special webinar, A Vision to Transform Canada's Public Health System with Dr. Theresa Tam, Canada's Chief Public Health Officer. My name is Ian Colbert, and I am the Executive Director of the Canadian Public Health Association, and we're very pleased to host today's special webinar. While we are coming together on this virtual platform from all corners of Turtle Island, I want to acknowledge that I am participating from CPHA's offices that are located on the ancestral and unceded territory of the Algonquin and Anishinaabe peoples. CPHA is committed to truth and reconciliation and is working with members of our Indigenous Advisory Council to transform CPHA into an anti-racist and anti-oppressive organization that is a valued ally of Indigenous peoples, communities, and organizations. So feel free to use the chat module to indicate from which traditional lands you are joining. This webinar is being recorded and will be made available on CPHA's YouTube channel later this week. Everyone who registered will be notified when the recording is available. If you want to pose a question, please do so using the Q&A module at the bottom of your screen. Our special guest today is Dr. Theresa Tam, the Chief Public Health Officer of Canada, a position to which she was appointed in June 2017. So she's just coming up on her 5th anniversary, but I'm sure it feels a little bit longer than that. She has been the federal face of the public health guidance over the past 2 turbulent years, and she and her provincial territorial counterparts have guided the country through what we hope has been the worst of this crisis. Along the way, she has recognized how inequitably COVID-19 has impacted different communities and how this virus has shot a spotlight on holes in our health and social safety nets. More importantly, she recognizes that an opportunity now exists to transform Canada's public health system. As she wrote in her message in the 2021 Chief Public Health Officer's report on the state of public health in Canada, we must act now to ensure that our post-pandemic future is different than our pre-pandemic past. And that is why you have joined us. So with no further ado, I will turn the floor over to Dr. Theresa Tam.
Thank you so much, Ian, and to the CPHA for this kind introduction. Hello, everyone. Bonjour à toutes et à tous. I'm really happy to be here. And thank you to all of you who are participating in the evening after what has probably been a really busy day. I would also like to acknowledge that I'm speaking to you from the traditional and ceded territory of the Algonquin and Anishinaabe people. Les peuples autochtones vivant partout au Canada ont fait preuve d'un leadership et d'un esprit de collaboration communautaire exceptionnel en réponse à la pandémie de COVID-19. Les dirigeants de la santé publique de tout le pays, y compris moi-même, sont déterminés à faire progresser l'équité en matière de santé. On comprend que la reconnaissance de droits et le respect par l'entremise de nos partenariats et de notre collaboration avec les partenaires autochtones sont essentiels pour remédier à une inéquité. Over the course of my discussions with many Indigenous leaders, I've really come to appreciate that we are united in envisioning a better future for all. We can learn from each other by listening, respecting multiple perspectives, and working together to benefit all people living in Canada. I note the important development towards self-governance in 5 communities within the Anishinaabe Nation in Ontario, who signed a landmark agreement with the federal government earlier this month, following 2 decades of negotiations. Similar efforts are underway across our country and represent an important step towards truth and reconciliation. Je suis heureuse d'avoir l'occasion de vous présenter les points salants de mon plus récent rapport annuel. Each year, I publish a report on the state of public health in Canada, and I've been using these annual reports as a means to stimulate discussion and catalyze action on pressing public health issues. And these reports are developed and informed through evidence reviews, dialogue sessions, and expert advice. So my 2020 report, which my team and I developed through the first wave of the pandemic and coming out of the first wave, focused on an equity approach to COVID-19, including the broader impacts of the pandemic. My 2021 report, which is the focus of tonight's conversation, is a direct follow-up, which on one thing that I called for in the 2020 report, which was creating a transformed public health system that will protect us against current and emerging public health challenges. So of course, I think we've come to the understanding that COVID-19 and the SARS-CoV-2 virus will be with us for some time. It has affected everyone in this country, also the rest of the world. This is a shared experience, but it has been affecting different people in different ways. So it is a very significant teacher moment that has occurred in our lifetimes, or certainly in our work lifetimes. And I certainly feel that it's one of those now or never moments to make public health stronger and to advocate for a different way of looking at health in Canada. That is not just focused on healthcare, but on the more upstream prevention and health promotion. So it's really calling for a cultural shift in how we look at health in this country. And of course, the report essentially advocates for more sustained attention, more focused attention and funding for public health. In my last report, I was also trying to provide some examples of the strengths in public health, so building from strength. And when I started the 2021 report, COVID-19 vaccines were just beginning to go into the arms of those at the highest risk. And we just began to learn about that Greek alphabet of variants of concern, from Alpha now to Omicron. So it was very difficult, of course, trying to do a report in mid-pandemic. But one of the things, of course, I highlighted was the incredible effort by everyone in this country to roll out one of the most complex vaccination campaigns ever. And the end result is that the very large majority of people living in Canada have received 2 doses of COVID-19 vaccine, which helped us attain very high levels of vaccination-induced immunity. So over 83 million doses have been administered in Canada. So as we continue to roll out booster doses, and I think this is National Immunization Awareness Week, it is a really great chance to ask everyone to get up to date with their routine immunizations as well. So of course, this is a role of public health that the general population and our decision makers can appreciate. But there are many other roles maybe that they're not as familiar with. I think we're in an interesting period at the moment that is quite difficult. I've called it the transition period in pandemic terms, moving from a crisis phase, not in quite yet knowing what endemicity means, but this transition on the road to get there is going to be full of bumps. And it's going to be the time when people will want us to review what's gone well, what hasn't gone so well, what we can learn, and some of the reviews. And indeed, when we're expected to provide some recommendations and ideas about public health transformation. And I think I was trying to advocate for the fact that it is through a healthy and therefore resilient population and a strong and agile public health system that we will be able to withstand the impact of pandemics to come and to manage the current pandemic that we're in. I certainly wanted to offer a perspective of the pandemic that was beyond the direct impacts of the virus, that highlighted health equity, intersectoral collaboration, and social cohesion. And social cohesion was a really important aspect of the response that required trust in our public health institutions from our communities and our population. And in this sense, public health absolutely is local. So I wanted to emphasize that all levels of government needed to work together to support diverse communities, including business and private sectors, so they can follow public health measures. So really, my last annual report tried to take some of these concepts and outline a vision for the future public health in Canada that is equity-driven, trustworthy, participatory, and effective. And many players involved in carrying out this vision, including all of you who are listening tonight. I think during the pandemic, there have been some great examples of innovation, resilience, and collaboration. And we need to harness these successes at the same time as recognizing and addressing long-standing gaps that have plagued public health, quite frankly, for decades. Many of us are, often doubting whether it's so recalcitrant that these won't be addressed before we retire. But I'm a positive person, and I think that this is a window of opportunity to address some of these. Because a public health emergency as huge as this has got to be a catalyst that we need to leverage to drive change. And so I think our public health system needs to be reinvigorated in order to prepare for future emergencies, and as well as continuing the challenge of COVID-19. And at this time of transitioning, we are beginning to also focus on some of the other urgent issues that need our attention, including the polysubstance use crisis and challenges around public health. So I think the many levels of the public health system are grappling with trying to get some of this balance while trying to recognize that the SARS-CoV-2 virus isn't done with us yet. One thing throughout my conversation in developing the report was that people, stakeholders, experts still stress that we need to communicate what public health is and how it works. And it's very difficult to advocate for public health if we don't have a common description and understanding of public health across Canada. COVID-19, of course, has opened a window and told people one of the most important aspects of the work of the public health system, which is in health protection or health security and pandemic response. But I was trying to really highlight the other roles public health plays in keeping people healthy, of course, preventing injury, illness, premature death, contributing to health equity. So one of the chapters, the second chapter in my report, I tried to provide at least a framework with a graphic that tries to describe the roles and functions of public health with health equity at its core. And I offered a common purpose, aims, essential public health functions, which many of us know about, but also 6 building blocks, just to frame some of our conversations that we need to have going forwards about strengthening public health. And so I think one thing about the pandemic is it has shown the really important need to address complex public health issues through whole of government and whole of society multi-sectoral responses. So we need to sort of harness some of that kind of collaboration and intersectoral linkages that has occurred. And while past reviews have raised many challenges, which, as I've said, was longstanding, I was trying to just lay out these challenges in 6 different areas, and these include inequitable outcomes of public health, our fragmented data systems and challenges in getting the right information at the right time to the right people, challenges around governance of public health, data's health and technology infrastructure, gaps in our public health competencies and expertise, and finally, insufficient financing, including this boom and bust funding approaches that we've all experienced. But I think the pandemic highlighted that innovations can happen. We can have these more robust ways of working together that are not only needed, but are absolutely possible. I think it's really difficult to think of these, what appears to be somewhat recalcitrant issues, if we didn't leverage the pandemic to show that it is possible, change is actually feasible. And so taking a strength-based approach, I think is really important. In the way forward, which is the final chapter of the report, I offered a few different suggestions on some of the priorities. So public health certainly needs focused, sustained attention and funding, alongside, of course, the importance of healthcare, primary care in particular, long-term care, and building resilient and healthy populations. So what are some of the priority actions to stimulate this change, and how can we move forwards? So I offered 4 key areas of concrete action. Dans la section finale de mon rapport intitulé La voie à suivre, présente 4 domaines d'action prioritaires. So our chances of success will be greatest if we did work together across our different levels of government, but also across sectors. So I'll challenge all of you, all of us, to think about these areas for action and how they can be addressed. So number 1, how can we foster excellence in our most important resource, which is the public health workforce? I think everyone's burnt out and probably tapped out before the pandemic, but certainly fatigued and burnt out now. But we need to continue to nurture and grow our workforce and ensure that it has a very strong foundation in sciences and in the function of public health. And I think if we have time, we'll discuss some of the reinvigoration and updating of our public health competencies. But I think that is really important for our future and current public health workforce to be supported and through a number of training programs and academic linkages and other kind of I think partnerships, so that our workforce is and our systems is a continuously learning one. Our goal should be to recruit and retain a workforce that has both deep expertise in public health and the ability to work, of course, across many disciplines. Partnerships are very important, and partnerships with communities like NGOs, the Red Cross, businesses that have really been strengthened throughout the pandemic should be leveraged. And so I think without communities, without community volunteers, we would not have been able to carry on with our public health response, but a lot of our other public health functions. And there are many examples. I'll pick a few, but I think it's important for us to share these examples and as much as possible, try and do knowledge translation across this country. So for example, in the Yukon, we had volunteers formed in Dawson City to help people self-isolate. In Haines Junction, they created a volunteer network to bring food to families. You've heard many of these stories. In Teslin, an informal network of family and friends supported many others. And we've got to really leverage the spirit of community in Canada to support public health. Another skill set and training and area development is the area of behavioral science, also our social media smarts. This is pretty unique pandemic. It's the first one in the social media age. So some of the public health competencies needed to be updated so that we can respond to mis and disinformation. There are other important skill sets like ethics and political sciences. Many of my colleagues in the Chief Public Health Officer said, well, I wish I learned more about politics before I got into my job. But I think we are all trying to learn as we're going along. But how can we make this more structured, perhaps going into the future? Where I live in Ottawa, there's been incredible local level communication innovations. In the province of Nova Scotia, they adopted many online communication approaches by taking slightly more humorous and different softer tones on social media, incorporate videos by private companies. So there's lots of innovation, and we need to sort of learn from it and see how we can move from here. We've certainly leveraged social media content creators, our professional debunkers, vaccine confidence experts in trying to help with the current pandemic response. One other area that we need to be better at is looking at surge capacities, whether they be for contact tracing, clinical expert linkages, pharmacists who's been doing so much more in different areas that have been beyond perhaps their professional practice in the past. And I said, leveraging the Red Cross and leveraging NGOs. And the second area is the need to improve really our public health toolbox And through better cross-sectional data, biomedical tools, evidence synthesis and translation, and including modeling and foresighting, and coordinating public sector research approaches that connects evidence to practice. So I think everyone knows the importance of this aggregate data that have been pretty important, and some of the gaps has been shown during this pandemic. Without this level of disaggregation of data at the community level, for example, we can't really tailor our responses. So if the future of public health is at the neighborhood level, then we need the data to support local action. So I've highlighted some of the examples recently for in other talks. Toronto Public Health collected information, disaggregated data on Indigenous identity, racial groups, income, and household size. That made a difference when they were trying to target public health interventions like vaccines, vaccine clinics, and testing interventions. And I think in February, Team Toronto and Toronto Public Health announced its shift of resources to a hyper-local equity-focused campaign to increase vaccination opportunities in focused communities with low vaccine uptake. That's what I've been trying to convey as precision public health, having the data at a certain level to help us support our communities better. And so even when we do collect this aggregate data, the data are not always standardized, widely shared, or accessible to people who need to use it and to Canadians. So at the Public Health Agency, the Center for Chronic Disease Prevention and Control is trying to work on this through the publicly available Health Inequalities Data Tool, but we still have lots more to do. During my report development process, I commissioned a number of external reports, independent reports. One of them was written by Dr. David Buckridge that elaborates on some of the issues with data and proposes recommendations for the next steps. It is available on the Public Health Agency's website for those interested on this topic. We also have Dr. Vivek Goel, who's chairing our external advisory group on the Pan-Canadian Health Data Strategy topic in of itself will take quite a bit of time, so I won't go into details. The third area of transformation is to modernize our models of governance and ways of working together. We can start by strengthening the mandates of public health, clarifying the public health roles and functions, and making governments more accountable. First Nations, Inuit, and Métis peoples' expertise and perspective must be meaningfully included in these processes. A forward-looking vision for public health is described from a range of Indigenous perspectives, First Nations, Métis, Inuit, in the commissioned report by Doctors Margot Greenwood and Evan Adams, titled The Visioning the Future, First Nations, Inuit, and Métis Population and Public Health. Please go check it out. Another commission report is by Dr. Erica Di Ruggiero on public health governance that provides a comprehensive outlook of the components of governance models within Canada and internationally, and suggests recommended actions for the way forwards that specifically addresses health equity. So I think that one of the areas or gaps identified in this report and the report on governance is establishing a stronger public health research agenda to inform public health system transformation. And my office established a brief document which outlines some of these proposed priority areas for researchers and includes Indigenous public health research priorities that were identified by Drs. Greenwood and Adams. And I was really, really happy that shortly after this document was released, CIHR launched a Catalyst grant funding opportunity designed to fund research that's aligned with some of the priorities in my report. The application deadline is May 4th. I hope all of you who have an interest in public health research, and particularly at ones that inform public health system transformation, will apply. In the last area of challenge, I talked about sustained investments in public health and demonstrating its value in a way that matches the mandate, and reporting is a really significant hurdle for all of us. Public health investments are difficult to track and monitor. public health funding are not necessarily tied to clear accountabilities. And we are susceptible to the panic and neglect funding cycles. And I'm personally quite concerned that the window of opportunity is in fact narrowing quite fast, even though this pandemic is still with us. And I think if local public health is adequately resourced, then staff can work hand in hand with communities by establishing the relationships, then great work happens. So the last commissioned report by Dr. Kate Mulligan that I commissioned addressed some of these ideas, including stable core funding. In her report, she, on the future of talking about the future of public health is at the neighborhood scale. It's about strengthening these community connections. So I hope that report resonates with many of you who may be working at the local level. Each of these reports, these 4 commission reports, are the subject of a free online webinar hosted by the National Collaborating Centers for Public Health. Registration is still open, and I hope you have the opportunity to participate. Certainly the voice of public health is needed in our current recovery discussions, and knowing that investments in public health are investments for equitable society. Donc, en sachant que les investissements en santé publique sont des investissements pour une société équitable, il est primordial d'intégrer l'optique de la santé publique dans les discussions sur le rétablissement. And we have seen that cross-sectoral action is really critical throughout our pandemic. So, but we really need to, I think change is feasible and within reach, but we really need to seize the current moment. I think that, you know, I'd like to leave all of you now with 4 challenges to consider in your own work. One is, how do you support a world-class public health workforce? 2, what parts of the public health toolbox do you use or advocate for? 3, how are you involved in the evolution of our governance in public health? And 4, how do you play a role in demonstrating value in upstream investments? How do each of us address gaps in the inclusion and support of Indigenous public health and Indigenous public health interventions? All of us should be able to see ourselves in one of these challenges. So please be a leader and a creative thinker at whatever stage you may be in your public health career. Je vous remercie de votre travail et votre résilience face à l'adversité et de vos contributions pour affronter cette pandémie. Your contributions to addressing this pandemic have been immeasurable, and the impact you have is limitless. So on behalf of everyone in this country, I thank you. Merci. Megwich. Thanks, Ian.
Thank you so much, Dr. Tam, for a great start for a conversation this evening. We have a ton of questions already. So let's just jump right into them. The first one is, asks, I've heard your references to improving the work we do in knowledge translation. Can you elaborate on your vision for knowledge translation and mobilization in public health?
Yes, so I think that's very much integral into transformation. When the Public Health Agency was created post-SARS 2003, I think knowledge translation was very much part of our mandate. And the National Collaborating Centers for Public Health were created also to enable that vision. And I think it still very much remains part of the way forward. So I had slotted that into improving our public health toolbox, but it's really quite a horizontal area of strengthening that we need to do. So I think linking between academic and research organizations is really important because they've done some of the research. But translating that into practice, I think, needs the NCCs, but other public health entities, and occurring at every level. I think even during this pandemic, it was quite difficult for us to rapidly turn around a whole bunch of scientific knowledge. And really, in a matter of hours, that's how I feel anyways, trying to pull it all together, lots of uncertainties, but then affect public health policies, programs, and indeed public health messaging and public health action, trying to change behavior. That was extremely difficult. So I think we do need to take a little bit of time to stand back and look at how that was done and how we can improve on that. But for sure, it should be part of the public health system capacity. And we need to integrate that workforce as well into our multidisciplinary core, because it's so vital. So the knowledge translation expertise may be linked up with behavioral insight specialists and others to get that information out. So I'm not sure if that really answers your question, but it should very much remain part of the public health vision.
Great, thank you. So a two-part question, but we'll start with the first part. What role, if any, do you believe community-engaged research should or will play in public health promotion within Canada?
Well, first of all, I just want to acknowledge that many of you in the audience might be more of an expert in this area than I am. Certainly, I think there's a lot of promise in using public community-based participatory research as a tool in public health and health promotion. And I think that it absolutely has a role, because participation, I think, is one of the key principles underpinning a world-class public health system. It's one of the fundamental foundations and principles that I put in my report. And so involving community members, the communities and the population we serve in the design and implementation of research and research projects that is aligned with their needs and their priorities is extremely important. So this collaborative approach should be further strengthened in our research approaches. So for sure, I'm linked up with CIHR in looking at how we strengthen these approaches and methodologies, which I actually think is pretty essential. But one thing, and I might be speaking because I'm ignorant, but I think that community-based participatory research is recognized as a pretty potent research paradigm to reduce health disparities. Yet I think there should be more research on the long-term health effects, system changes, sustainability, transfers, cost effectiveness of this type of research, and thus its public health impact. I think there's some publications, and I'm sure I haven't read enough of them, but really trying to, those of you who are engaged in this research, looking at the impact of such research will be really important. Another thing that just came across the front of brain for me was that this type of research is very much aligned with the guiding principles of many Indigenous communities, which is the 2I seeing guiding principle, where the benefit of co-learning and gaining multiple perspectives for the benefit of all is so fundamental. So it is really, really important in terms of collaboration and co-development, co-learning, co-implementation as we move forwards on research involved that is led by Indigenous communities.
Super, thank you. So the next question, I think, is a trick question. I think the Questioner is trying to ask you to pick your favorite child, but the question is, what area of public health is most important, and what areas do you anticipate to grow post-pandemic?
That is a hard question, and the report is trying to do some of that and lay it out in a frame so that people can really put their ideas within a framework, because it can seem a bit overwhelming, I think, because there's so many different areas that we can strengthen or improve on. But certainly leveraging on strength, as I said, is really, really important. There is no doubt that people will expect us to be able to manage health risks like a pandemic, like infectious disease risks. That's got to be an area of excellence. And we will be asked to sort of elaborate on how we would do better and manage the pandemics to come, which are inevitable. And so that is almost the stepping stone to looking at the public health system strengthening writ large. We've got to use this window of opportunity. But I think using the pandemic as a demonstration of why a healthier population through health promotion, upstream investments is our best defense against the next pandemic, as well as a robust public health system, I think is an approach or a framing that could resonate. At least we got to have a go. The health inequities that are really made obvious by the pandemic that everyone here understands, we got to be able to describe that and be able to communicate that to decision makers. But broadly speaking, that's why I've ended up on really 4 areas and using some building blocks, because it's difficult to pick your favorite child.
It's a trap. I told you.
I know. Ian, what are you doing to me?
So the next question is, do you think the collection of race-based data is a critical gap missing in the COVID-19 response, as well as Canada's public health space in general?
So I think collecting that disaggregated data, including race-based data, is important to better support our communities, because we do know that different communities experience health risks, health challenges, whether it be chronic diseases or indeed an infectious disease, are very different. And without that information, we can't best serve our communities or indeed address inequities. It is certainly one really key aspect of the types of this aggregation and analysis that we need to do. I gave a really good example of some local level data that is able to leverage race-based, social, economic, and other data variables in order to better provide programs and services. So I think it is really important. There have been some significant gains, I would say, during the pandemic, which needs to be recognized. We need to collect information on those advances, whether it's at the local level or indeed we've been trying to improve the national pan-Canadian data set, which includes race-based information. It's not filled out very well, but we're making some steps forwards. So I think, I am trying to remain optimistic that we can do this, but engaging different population and racialized groups and their leadership is really important. And I do think there's been quite a lot of good demonstrations of how the translation of that data, married with some support for community leadership in racialized population, has advance public health action, including the uptake of vaccines in different areas of the country. So yes, I guess the bottom line is it is important because we cannot address equity, we cannot address the tailoring of public health measures without that kind of information. It would be like, I keep saying, it's like, steering blind within a public health context. If you don't have data, it's like the GPS, that's part of our role, I think, as we engage other sectors, housing or other sectors, our role is to bring that data and that GPS for navigation purposes so that others know that they have an important role in addressing public health in Canada.
Great, thanks. Now, I'd love to dive into a conversation about whether or not health data is healthcare, or as Dr. Michael Wolfson has gotten into recently, but we won't dally in constitutional waters tonight. So we'll move on to the next question from the audience. You have spoken about agility going forward in order to be poised for future public health emergencies. Do you believe that the interdepartmental and interprovincial capabilities of today meet the complex demands of such public health emergencies? Part one. Part two, what should we be thinking about in terms of evolving national capabilities and governance to ensure agility and cohesion sought at all levels?
That's a very complicated, I hope I can remember what you just said, but I think in a nutshell, scalability and agility and flexibility has to be a characteristic of the public health system and our workforce and our capabilities going forwards. There is no doubt in my mind that the kind of surge capacities and the attention paid to public health will not stay at this scale for a very long time. And we need to be able to note down all the different surge capacities and flexible policies and other levers that have come into play during this pandemic, because I believe they'll be very important for the next one, or to confront complex health issues or societal issues, including climate change, for instance. So nailing down whole of government, whole of societal governance is really important. I certainly haven't, to this point in my career, been able to access all ministers at the same time, who all think they have a role in essentially public health. And so those who are finance ministers, or those in charge of social policies, housing, the borders, and many other different departments saw the role. Those who procure different PPE or rapid tests, everybody seems to have a role. And being able to capture those roles and the policy levers and how that helps to support public health action and what we're asking our population to do, I think is a really important step during this lessons learned phase. And see if we couldn't keep some of these multidisciplinary, multi-sectoral, multi-departmental tables as we go along to tackle these other complex issues. I've heard many reports from my colleagues at the provincial level, but certainly at the local levels, about the much better intersectoral linkages that they've seen. And we just can't let that slip away post-pandemic. We can certainly remind people what their roles have been during a large public health response. I think maintaining partnerships, maybe more actual agreements and more formalized relationships with the people, the populations who've come in to help with the public health response is really important. I think we came to appreciate that Red Cross, for example, provided a lot of surge capacity. We certainly leveraged Red Cross really a huge amount during the provision of surge not just to public health, but to healthcare and long-term care. We have worked, I think, a bit better with the academic sector and the students and the trainees, and we've worked better with other health professionals, pharmacies, for example, who've, as I said, really expanded the scope. Immunizers don't have to be, or public health nurses. There's many different people that have been trying to help. Businesses and the private sector have also played a key role. So I think we have to be more flexible and be able to include others who can help us and be in a position to receive that help should we need it in a more systematic way.
Excellent, thank you. I'm going to jump ahead to a question that asks, Canada had a pandemic influenza agreement with the USA and Mexico that could have resulted in a more collaborative pan-North American management of the SARS-CoV-2 pandemic. The political environment at the onset of the pandemic did not result in its utilization. Do you see that there is a role for international collaborations and preparation plans moving forward? And if so, how do we ensure that those plans are used?
Well, I think a pandemic is a global phenomenon. I mean, that is quite easy to convey on the one hand. But we have seen, I think, a movement towards every country looking after itself, although at the same time, at least conceptually, know that we can't end this pandemic without global collaboration and addressing equity, and including, for example, vaccine supply on a global scale. So, and a lot of these policies and concepts are in a bit of tension. And I think that the international borders is a big has been a big challenge. And in the North American pandemic influenza plan, possibly because we felt, I guess, we had a different risk perception of influenza in the pandemic, perhaps than this very much unknown virus. We made certain assumptions at the outset that border measures are unlikely to last for very long, and we needed a collaborative approach. And which didn't really happen during the COVID-19 pandemic. Some of it is because, of course, policies ultimately is a decision at the political level, and every political decision maker needs to support its own population first. That's just a given. But how do we, in that, with an understanding that that is the expectation, still use different collaborative mechanisms to affect international cooperation and collaboration? There's a lot of work going on right now in looking at the international governance and international construct, re-looking at the international health regulations and the global governance. And so I think it will be very interesting period of time working with the World Health Organization and other countries and the United Nations system to see what global public health and collaboration would look like. I think it's going to be challenging just because there's different, not just in the public health domain, but in many other sectors. I kind of feel that countries really needed to look inwards and develop domestic capacities, and they are being criticized at the political level if they didn't have domestic capacity. So it's become, the pendulum sort of swung a lot in that direction. And we really need to then sort of relook at how do we reset international collaboration. I am still, quite, how should I say, the day that we implemented, Canada did, international border measures was something that was really etched in my consciousness, and something that was quite astounding, and the world coming to a standstill. This is not just Canada, the whole world coming to a standstill was not something that I personally envisaged and for a significant period of time. So I do think that in public health, we have to really stop this them and us narrative. I think we have to do our part in bringing people back together again, and through so many aspects of our work going forwards.
Great, thank you. So turning to public health workforce for a moment, a question is, should we be using or better using a public health qualification or some kind of credentialing system amongst registered health professionals? The questioner goes on to say, it would seem that COVID has shown that any physician or nurse can do public health, and that actually undermines public health moving forward to a more clinical approach and less of a population focus. So do you see a role for a public health designation going forward?
Yeah, I think, first of all, the public health system, public health practice, I do think needs an identity. As I said, we're in a bit of an identity crisis, because people don't understand what is it. So being able to clarify that and look at that scope and mandate is really important. Having said that, public health, I do believe, is a specific field of practice. And as in any field of practice, there are specialists who are very highly trained in this field, armed with a variety of competencies, which we can relook at, and requires comprehensive training and experience in order to elevate the competencies and the credibility of public health. I think that's really important, but public health itself has many interdisciplinary approaches and can accommodate people who may have come from different fields of practice to start off with, but do contribute to public health. So I think there's public health specialists perhaps, but working with a whole multidisciplinary field is what we need. We can't find the same set of skills in every single individual. So a multidisciplinary team is inevitable, including people who can debunk mis and disinformation. So maybe the answer is yes and no. Yes, you need both. You need that team and you need others, perhaps trained at a different level of public health competencies that would build on top of their existing competencies, and then a whole group of individuals with a public health specialization who can play many different roles, including leadership roles in the system.
Great. Thank you. So another interesting question, the pandemic and the climate crisis have shown clearly the need to link nature, sustainability, and public health. Where does that relationship fit in your vision for public health?
I think climate change, the health impacts of climate change is being described. There's many now reports coming out. And it is yet another very complex societal and global planetary challenge and priority. But I think public health can in more concrete terms, show the populations that we serve what climate change actually means in their lives. I certainly think, ozone layers, CO2 levels, carbon pricing, etc., is a little bit abstract in people's minds, but they can really relate to their personal experiences and the experiences of the communities when they see the health impacts in real time now, whether it's a heat-related emergency, forest fires, floods, environmental air quality issues, which goes back to some of the roots of public health, of course, can really help move the agenda forwards in a planetary health or supporting the climate change agenda writ large. So I do think we, in the next years, should be able to be more focused, I think, in the public health role in supporting, I would say, again, adaptation, of course, is one area that will be playing a role in, but the more upstream health promotion also come into play. I think we are perhaps the specialists in really complex issues that require convening multiple sectors, and we may be able to contribute in that way. Some of my first report was actually on building healthy communities and the built environment. A lot of work has been done there by different public health practitioners to build better cities and urban and rural communities. So I think we can contribute in that way. I will be this coming year focusing my next annual report on climate change, and with of course an equity lens as well, a health equity lens. And so I think we can contribute in a lot of different ways, and I think I would not be surprised if it was on the top of the list of many public health organizations' priorities. I have the pleasure of working with IANFI, which is the International Association of National Public Health Institutes, and they're very seized with climate change and public health action in this area. So I certainly look forward to your ideas as to how we can contribute.
Great. Now we're getting very close to the top of the hour, so I think we probably just have time for one more question, and hopefully it's not too much of a stumper for you. But given your experience in government and things that have evolved, such as the New Zealand model of a well-being budget, you've sat at those tables. Do you think it's possible, or how might it be possible to reorient the focus of governments from the health of the economy to the health of the population?
I think there's a recognition that the two are linked. You cannot have a healthy economy with a healthy population, and that is what the pandemic has shown. I don't know exactly how some of these decisions will be made in the future, but I think right now there's definitely a recognition of that policy concept. And so I think we should build on that approach, and coming out of the pandemic, not in a way that our decision makers don't lose sight of, well, remember that pandemic and how really public health and population health and all of that is absolutely important to the economy, and then the healthcare system as well, right? So one of the, I think you alluded to that in one of your non-questions, is not an either or. The healthcare system is important, long-term care, home care, essentially aging in place, all very, very important. But I think the public health system has been asked throughout the last 2+ years to protect that healthcare system that's fragile. So I try to emphasize that as well. And without a robust and resilient health system as a whole, public health and healthcare and everything in between, there will not be a great economy. And without a great economy, we also will not have great health. So making sure that that policy concept sticks will be one of our challenges and one of our tasks going forwards.
That's tremendous. Thank you so much, Dr. Tam, for taking the time to spend with us today. It's an hour of your day, which is precious, I am sure. I know it is. So it's greatly appreciated that you shared your thoughts with us and had this conversation. We could go on for another hour because we've got 19 unanswered questions, but we'll leave it there for now. But I want to thank you so much for spending this hour with us. And I want to let webinar participants know that the Canadian Public Health Association will be launching an advocacy campaign this fall directed at federal, provincial, and territorial politicians, talking to them about some of the levers they have at their control to help strengthen and transform Canada's 13 public health systems, and to perhaps bring some consistency, to raise some boats, as it were. A rising tide raises all boats, as they say, and to help improve population health outcomes across the country, across a number of different metrics. And so you'll see a lot of references to the CPHO's 2021 report in the advocacy work that we're doing. So please stay tuned, and we look for your support for that campaign. And keep in mind that Public Health 2022, CPHA's annual conference, is coming up June 14th to 16th, and we're going to be continuing these conversations during that conference. So check out the registration information on CPHA's website, that's cpha.ca. As I mentioned before, this webinar has been recorded and will be posted to CPHA's YouTube channel very soon, maybe even tomorrow, and we will let everyone know when it is available. So thank you again for joining us. Stay well, take care of yourselves and each other. Good night.